Welcome to the Schwab Report. Today my guest is Dr. Edward Laco. Dr. Laco is a family and implant dentist, and he joins us today from his office in Loves Park, Illinois. Dr. Laco just has a wealth of information to share with us. Dr. Laco, why is a dental implant often preferable to the traditional bridge?
We discuss this with patients a lot because we do see a lot of patients who have lost a tooth or are about to lose a tooth. And those are the first two options that come to mind. You can do a bridge, you can do an implant. Bridges certainly have their place in dentistry. We still do them. They're a little quicker to do. My preference is to do an implant, though. If I were to lose a tooth, I would be getting an implant in its place. Reason being is to place an implant in the mouth does not involve the neighboring teeth. If you have a space and you need to fill that space and you're going to do a bridge, you need to recruit the two teeth on each side of that space and put crowns on them. And in a lot of cases, those teeth have never been touched, so now you're putting crowns on a teeth for the sake of closing a hole, essentially. The other thing is a bridge is a 3-unit piece that you cannot get floss through. You kind of have to floss under them, which gets kind of tedious. And yet another thing, which is probably the most important reason we like to do implants instead of bridges, is what we call bone loss in dentistry. When you take a tooth out, bone kind of melts away. So what we often see is the place where we used to have a tooth starts moving away, moving down from the bridge, and now even if we come back 10, 15 years from now and say, now I want to do an implant, now we have a problem because we don't have the bone to put the implant in. So the quickest, easiest, and most efficient thing to do, and probably the cheapest long term, I would imagine, is place an implant when we lose a tooth. We have hundreds of patients out there with them, and they're happy. We've got about a 98-99% success rate with them.
You mentioned so many benefits. One of the ones that really impressed me is how reliable it is, because you talk about dental implants being so successful. I don't know too many dental or medical procedures that would have a 98 or 99% success rate. That must be very reassuring for your patients.
It is, absolutely.
Another point you made that struck me just now was that you said that when you do a bridge, sometimes you're going to have to cut down perfectly good teeth on either side. And it seems to me that the patient would want the dental implant, which sounds like the more conservative option.
Absolutely. And another thing that I didn't mention before that we talk about with our patients is putting the crowns on those two teeth to make that bridge. Though, I mean, it depends how long you need this bridge to function, but in time those will fail too. And what we see often is a bridge failing and yet another tooth being lost. So now what was once a one-tooth space can now be a two-tooth space. Now we have an even bigger problem than we had before.
I would like to thank Dr. Laco for joining us today. Dr. Laco is accepting new patients, and he may be contacted through his website, lacodds.com. That's LACODDS.com. This is David Schwab. Thanks for joining us today.